The first thing that you've mentioned is something that many people have said is that, it was harder to find the cricothyroid membrane than I thought it was. If that's the first time you're touching it in that moment of the beginning of the procedure, you're sort of evaluating in that panic moment, you're probably not performing at your best. And so
100%.
Rich Levitan made this statement. It's called the laryngeal handshake. In fact, he says he does it for any intubation he's doing because any intubation, any airway you're taking is a potential cric. And so this laryngeal handshake is when you're walking up, you ask the patient to open their mouth, you're sort of saying something. He just basically puts his hand out and he feels for that cricothyroid membrane and just identifies it. And that first step almost tells you, okay, I know kind of where it is. I don't want to use my physical exam skills when my adrenaline is really pumping and the sats are dropping and the whole room is looking. So I already know where to go. I have an approximate landmark for where that is. So just my first thought, it's always a good idea to do that laryngeal handshake for any intubation you're doing, especially the difficult ones. The second thing is in terms of, I like that you're making a large incision. That's the pitfall that most people don't do. That long incision is typically the thing that the person who does it the first time doesn't do right. What you realize over time is that you need the space to do your work in. This is not a moment to worry about cosmetics. Make your incision as big as you can so that you can find your landmarks and work within those landmarks a lot easier. In other words, when you poke through and you make that incision through the cricothyroid membrane, are you cutting one side, turning the knife around and cutting all the way the other side? And to your last point about the bougie, you didn't feel the rings. That doesn't surprise me because if you think about the rings are really anterior. Posteriorly is the non-cartilagous part of the trachea, and you wouldn't really feel the rings that way. So if you think you push your bougie down anteriorly, posteriorly, it's going to be all smooth tissue going down. We really feel the rings when you're doing intubations and you're putting your bougie in. It tends to have a little bit more of an anterior trajectory, which is where the rings are. Here you're going anterior to posterior, where there's not the rings that are going down. And that's probably why you didn't feel the rings in that particular instance.